Why should we talk about age and fertility? We often find women who approach our clinic as they have been trying to conceive and have failed to do so. We do certain investigations and then we find that they have very few eggs left in their ovaries. And that is when a very heartbreaking conversation ensues about the impact of age on fertility and the decline that is associated with it. And that's when I have often heard women turn around and say, I wish I had known this earlier. It is comments like this which has inspired our campaign, My Eggs, My Future. I will take you back into the reproductive physiology a little bit to understand this concept a bit more. Every female baby, when she's born with tiny structures, balloon-like structures in her ovaries. We call them primordial follicles. For the sake of ease, I'll call them immature eggs. We are all born with millions of these. They remain quiet till we reach puberty. Once the menstrual cycles commence every month, a few of these start growing. We call them antral follicles. One of these growing follicles is now destined to become large and release an egg. But all those others which had started growing stop growing, they are arrested and they undergo degeneration or destruction. So every month, essentially, as we are going through our reproductive years, we are losing a set number of follicles, and this is what is known as age-related decline in fertility. Once we sort of reach 35, we know that decline is steep if you look at the graph. And once we have reached 40 years of age, we are left with very few eggs in our ovaries. And that's the reason why when women, as they reach 40 or cross 40, when they try to become pregnant, they'll find that they're taking longer and more so, because with age, not only do we find that it's the decline in egg numbers, but also the decline in egg quality. It is because of that we find that when women post the age of 40, when they're trying to have pregnancies, they are at a higher risk of miscarriages as well. So the question arises, is there a test to assess someone's egg quality? Sadly, we don't have that. But what we do have is a way to assess what's left behind in the ovaries, and this is known as the ovarian reserve. The way we do this is by two methods. One is to assess a blood test called AMH, also known as anti-Mullerian hormone. And this is a hormone which is secreted by the growing follicles I mentioned earlier. The other is to do a pelvic ultrasound scan. So it's a transvaginal scan whereby we can count the number of these growing follicles. This is known as total antral follicle count. And that number reflects the total pool of follicles or the immature eggs which is left behind in someone's ovaries. So by looking at these two tests, we can assess where a woman stands in her fertility journey and give her a fair idea as to how she should plan. My name is Dr Praveena Pai. I'm a consultant gynaecologist at Herts Essex Fertility. Thank you for listening.